We are grateful for the opportunity to present our poster to you today focused on findings obtained through our ITP Natural History Study Registry on the impact of COVID-19 vaccination on adults with ITP. Our disclosures. This was a prospective cohort study. The ITP Natural History Study Registry is composed of 7 surveys designed to collect information on participant demographics, medical history, treatment history, quality of life in adult and pediatric ITP patients, and capture their experience with COVID-19 infection and vaccinations. The registry is accessible to ITP patients who are members of the Platelet Disorder Support Association. As of June this year, 338 adult participants completed the survey. Our ITP and COVID-19 survey was launched in February of this year. In terms of the types of participants completing the survey, the majority of participants were female and between the ages of 18 and 64 years. 35% indicated they were in remission at the time of survey completion. 24% indicated they had a splenectomy prior to survey completion, and 70% reported they had received at least 1 dose of a COVID-19 vaccine. 41% reported they were fully vaccinated, and as you can see from Figure 1 here, the majority were vaccinated with an mRNA vaccine such as Moderna or Pfizer. In terms of COVID-19 infection, 12% reported they were diagnosed with COVID-19 by way of a positive test. And as you can see from Figure 2 here, 32% reported they experienced a platelet count drop following infection, but this drop was temporary and 65% saw resolve back to baseline within 4 weeks. In terms of COVID-19 vaccination, as you can see from Figure 3, most participants did not experience a platelet count change. If we focus on responses to the first dose of a vaccine, 32% experienced a platelet count drop. However, 84% reported their platelet count returned to baseline within 4 weeks. Following the second dose, 27% reported a platelet count drop, and 71% reported that within 4 weeks their platelet count had returned to their typical baseline. 3 participants had reported bleeding symptoms post-vaccination, and these included epistasis, wet purpura, petechiae, bruising, and a gastrointestinal internal bleed was reported in an asplenic 64-year-old female with alpha-gal allergy. 2 women, aged 35 years and 47 years respectively, developed a blood clot after receiving a Pfizer vaccine with no past personal or family history of hypercoagulability. 14 participants, which included 13 females and 1 male, reported large platelet count decreases greater than 100,000 cells per microliter of blood following a COVID-19 vaccination. 8 had received a Pfizer vaccine, 5 Moderna, and 1 received an AstraZeneca vaccine. However, only 1 of these 14 required treatment, and 2 had had a pre-existing autoimmune disorder, and 8 had had a previous splenectomy. 30 participants reported that they had a platelet count change following exposure to a non-COVID vaccine. And when we looked at this group, 23 shared their experience post-dose 1 of a COVID-19 vaccine, and 11, which represented 48%, had experienced a drop in their platelet count following a COVID-19 vaccine. In conclusion, these results should be reassuring to ITP patients and their healthcare providers as the risk for aggravated thrombocytopenia specific to the COVID-19 virus and vaccine are small. While platelet count drops were reported following vaccine receipt, they were rarely substantial, and most decreases resolved within 4 weeks. There were only 3 cases where bleeding symptoms were reported, but all had responded well to a typical ITP therapy regime. These results should reduce vaccine hesitancy among the ITP patient population. Thank you so much for listening to our presentation.